So it's an operation. So inevitably it's done in a theatre suite, and most patients are asleep for the operation. And that will be a general anaesthetic administered by an anaesthetist. Then during the operation itself, what it would involve is initially an examination. And that's when the patient's fully relaxed. You can actually get a good idea of how loose the ligaments are. And essentially what you're looking to do at that stage is confirm your diagnosis and make sure that the element of ligament injury that you're treating is going to be treated by the type of surgery that you perform. After that, then the patients are typically prepared with an antiseptic solution, and drapes are applied, and then an incision is made on the side of the ankle. Now, most ankle ligament stabilization surgeries happen on the outer side of the ankle because that's the most commonly injured area. And what it would involve is identifying the ligaments, identifying the areas where it's been torn in the past. And typically, you don't always see where it's been torn in the past. All you'll see is some boggy, loose tissue. And then that's divided and excised. And then you bring the good tissue back up to the good tissue. And then you essentially suture it in place. And there's different ways of trying to secure it. So some surgeons will use suture anchors, which are little pieces of metal which go inside the bone and are attached to little suture strings. Other surgeons will do a direct repair of tissue to tissue, just use sutures in themselves. And then what will happen afterwards is the wound is closed up and a patient's typically placed in a plaster cast. And depending upon what type of surgery is done will dictate how long the plaster cast stays on for, and then usually a pneumatic walking boot, and then they'll progress to physiotherapy after that. So I would say that the vast majority of ankle ligament stabilizations involve something called the ATFL. That's the anterior talofibular ligament. And that's the ligament which is on the outer border of the ankle, just in front of the bone known as the fibula. And what that does is it stops the ankle from rolling over. That's the ankle ligament which is most commonly reconstructed or repaired. But sometimes when you have a more severe ankle sprain, the ring of injury carries on going around the side of the ankle, and something known as the CFL, or the calcaneofibular ligament, also needs to be repaired or reconstructed at the same time. So these days, ankle ligament stabilization surgery can be performed both arthroscopically or through open surgery. Each one essentially has its own good points and its bad points. So the advantage of an arthroscopic repair is that it's got much smaller incisions, but the downside is that it's very difficult to identify the tear, and what you're doing is really just reefing up tissue back to its footprint. With an open surgery, the actual incision is not that much bigger than what you'll see with keyhole surgery. But what it involves is a direct visualization then of the tissue and then bringing that back together. So it can be both performed arthroscopically and openly, and really the choice of technique depends upon the skills and experience of your surgeon. Most ankle ligament stabilization surgeries are done under what's known as a general anesthetic. So that's where the patient's fully asleep and doesn't feel a thing. That can then be supplemented, if needed, with either a regional block, and that's where the nerves which come down into the leg are anesthetized, or a local anesthesia block, and that's where there's infiltration of local anesthetic at the end of the case, just in the surrounding area. These days, it's less and less common to need to do an arthroscopy if you are doing ankle ligament stabilization surgery. What used to happen in the older days is often a judgment was based upon clinical decision making or an MRI scan, which wasn't necessarily as reliable as the MRI scans we get today. And that led to a high number of ankle arthroscopies also being done at the same time as ligament stabilization surgeries to see inside the joint and make sure that there were no concurrent injuries. These days, the kind of advent of good quality MRI, and especially something known as 3T MRI, which is the latest technology, allows people to visualize the joint surfaces and also the tendons very accurately, and then it can be decided if in advance it's needed to perform an arthroscopy or tendon repair. I would probably say in my practice, probably that less than 10% of ankle ligament stabilization surgeries require an arthroscopy or a tendon repair at the same time.